Good morning. Today I want to briefly go over depression, a condition we encounter frequently in clinical practice.
Yes, doctor. I know depression is commonly used to describe sadness, but what exactly defines it as a disorder?
Great question. You're right. Depression is often confused with normal sadness. But clinically, it's far more than that. Sadness is a natural emotional response to life events, like losing a loved one or failing an exam. It's usually short-lived and proportional to the situation. However, depressive disorder, or major depression, is a clinical syndrome characterized by a group of persistent symptoms that affect a person's mood, thoughts, and physical well-being.
So, how do we define it diagnostically?
We use classification systems like the ICD-10 and DSM-4. Let's begin with the ICD-10 criteria for a depressive episode. It requires that core symptoms be present for at least 2 weeks. These core symptoms are depressed mood, loss of interest or enjoyment, and decreased energy or increased fatigue. In addition, there are 7 other associated symptoms, such as reduced concentration, low self-esteem, guilt, suicidal thoughts, sleep disturbances, appetite changes, and psychomotor agitation or retardation.
What about the DSM 4 criteria?
According to DSM, for a diagnosis of major depressive disorder requires at least 5 out of 9 symptoms, including at least one of the 2 core symptoms, depressed mood or loss of interest, for a minimum of 2 weeks. The DSM criteria are very similar to ICD, but slightly differ in emphasis and terminology.
Are there different types of depressive disorders?
Yes. 2 major subtypes to remember are recurrent depressive disorder, bipolar depression. In recurrent depressive disorder, patients experience repeated episodes of depression, mild, moderate, or severe, but with no episodes of mania. They usually recover fully between episodes. In bipolar depression, patients have both depressive episodes and manic or hypomanic episodes during their illness. Interestingly, depressive episodes in bipolar disorder are often longer and less responsive to treatment compared to unipolar depression.
How common is depression in the general population?
The community prevalence of major depression is about 2 to 5% at any given time. However, lifetime prevalence can range from 10 to 20%. Also, keep in mind that females are twice as likely to develop major depression compared to males.
What's the typical course of illness?
A single depressive episode usually lasts 1 to 6 months, but in 10 to 20% of cases, it can become chronic, lasting over 2 years. About 85% of patients experience more than one episode in their lifetime.
That's quite a relapse rate. Is there anything specific I should remember when seeing patients?
Absolutely. Always screen for duration and severity of symptoms. Ask about past episodes. Don't forget to assess for suicidality and understand the psychosocial context. Depression is common, but it's also treatable with medications, psychotherapy, or a combination. Early recognition is key.
Thank you, doctor. That was really helpful.
Thanks for watching this clinical breakdown of depression. Don't forget to like, subscribe, and share for more simplified medical lessons every week. Until next time, keep learning and stay curious.